Which of the following actions is most appropriate when a pharmacy technician discovers a medication on the shelf that has passed its expiration date? A. Place it back into inventory and use within 30 days. B. Return it to stock only after relabeling. C. Remove it from stock and follow proper disposal or return to manufacturer procedure. D. Dispense it if the patient needs it urgently and notify the pharmacist later. Answer: C. Expired medications must be immediately removed from inventory to prevent dispensing. Proper protocols include quarantining, documentation, and either destruction or returning to the manufacturer. A technician receives a prescription for warfarin and notices the patient is also taking aspirin. What should the technician do? A. Dispense both medications as written. B. Alert the pharmacist of a potential drug interaction. C. Refill only the aspirin and hold the warfarin. D. Substitute aspirin with ibuprofen. Answer: B. Warfarin and aspirin increase the risk of bleeding when taken together. A technician must inform the pharmacist to evaluate the therapy for safety. Which regulation mandates that hazardous drugs must be handled using PP and engineering controls in pharmacy settings? A. HIPAA. B. OSHA. C. USP less than 800. D. DEA schedule. Answer: C. USP less than 800 outlines safety standards for handling hazardous drugs to protect healthcare personnel and the environment. A medication order for a hospitalized patient includes cefazolin 1G4Q8H. What is the total daily dose? A. 3G. B. 2G. C. 1G. D. 4G. Answer: A. Q8H means every 8 hours. In 24 hours, that's 3 doses, 24 divided by 8, each 1G, totaling 3G daily. According to federal law, what is the maximum number of refills allowed for a Schedule III medication within 6 months? A. 0. B. 2. C. 5. D. Unlimited. Answer: C. Schedule III medications may be refilled up to 5 times within 6 months from the date the prescription was written. Which dosage form is designed to release a drug slowly over time to maintain consistent blood levels? A. Sublingual. B. Enteric-coated. C. Buccal. D. Extended release. Answer: D. Extended release, ER, XR, SR, dosage forms provide a controlled release of medication over time for prolonged therapeutic effects. What is the proper technique for cleaning a laminar airflow hood before preparing sterile compounds? A. Start at the bottom and move upward in circular motions. B. Wipe with alcohol using front-to-back motions starting from the dirtiest area. C. Start from the back and wipe toward the front using side-to-side motions. D. Spray bleach and let it air dry. Answer: C. Always clean from the cleanest, HEPA filter area, to dirtiest area, typically back to front in straight lines using 70% isopropyl alcohol. A pharmacy receives a prescription for amoxicillin suspension 250 mg per 5 ml. Take 10 ml every 8 hours for 10 days. How many ml should be dispensed? A. 100 ml. B. 200 ml. C. 300 ml. D. 400 ml. Answer: C. 10 milliliters per dose times 3 doses/day times 10 days equals 300 milliliters total volume needed. Which DA form must a pharmacy complete to order Schedule II controlled substances? A. DA Form 41. B. DA Form 106. C. DA Form 224. D. DA Form 222. Answer: D. DA Form 222 is required to order or transfer Schedule II controlled substances. What is the appropriate action when a technician receives a prescription with a potential allergy alert? A. Ignore the alert and continue processing. B. Confirm the alert and immediately call the physician. C. Notify the pharmacist before processing the order. D. Substitute the medication with a similar drug. Answer: C. Technicians must notify the pharmacist of allergy alerts so the pharmacist can evaluate clinical relevance. Which of the following medications requires a medication guide to be dispensed with each fill? A. Amoxicillin. B. Albuterol. C. Isotretinoin. D. Lisinopril. Answer: C. Isotretinoin has serious teratogenic risks and must be dispensed with a medication guide under iPledge. What is the beyond use date, BUD, for a reconstituted oral antibiotic stored in the refrigerator? A. 7 days. B. 10 days. C. 14 days. D. 30 days. Answer: C. Most reconstituted oral antibiotics have a bud of 14 days when stored in the refrigerator unless otherwise specified. What is the primary purpose of a formulary in a healthcare setting? A. To list medications banned by the FDA. B. To guide therapeutic substitution policies. C. To serve as an inventory tracking system. D. To allow patients to pick any medication. Answer: B. A formulary is a list of approved medications that are preferred for use within an institution to ensure cost-effective and safe therapy. Which of the following auxiliary labels is appropriate for metronidazole? A. Avoid dairy products. B. May cause drowsiness. C. Do not take with alcohol. D. Take on an empty stomach. Answer: C. Metronidazole can cause a disulfiram-like reaction when combined with alcohol, causing nausea, flushing, and cramps. A prescription is written for hydrochlorothiazide 25 mg per QD 30 days. How many tablets are needed? A. 15. B. 25. C. 30. D. 60. Answer: C. 1 tablet daily for 30 days means 30 tablets are needed. Which of the following is an example of a high alert medication according to ISMP? A. Acetaminophen. B. Furosemide. C. Insulin. D. Loperamide. Answer: C. Insulin is a high alert medication due to its potential to cause significant harm if dosed improperly. What is the total volume of a 1:1000 epinephrine solution if 5 mg is needed? A. 0.1 milliliters. B. 0.5 milliliters. C. 1 milliliter. D. 5 milliliters. Answer: D. 1:1000 equals 1 milligram per milliliter. To give 5 milligrams, you need 5 milliliters of solution. Which of the following temperature ranges is considered proper for storing refrigerated medications? A. 36 degrees Fahrenheit to 46 degrees Fahrenheit. B. 46 degrees Fahrenheit to 56 degrees Fahrenheit. C. 20 degrees Fahrenheit to 32 degrees Fahrenheit. D. 60 degrees Fahrenheit to 70 degrees Fahrenheit. Answer: A. Proper refrigeration range is 2 degrees Celsius to 8 degrees Celsius or 36 degrees Fahrenheit to 46 degrees Fahrenheit for most medications requiring cold storage. When repackaging medications, the pharmacy technician must include which of the following on the new label? A. Patient's address. B. Manufacturer's phone number. C. Drug name, strength, expiration, and lot number. D. Pharmacist initials. Answer: C. Repackaged medications must be labeled with essential information for identification and safety, including expiration and lot number. Which act created the requirement for child-resistant packaging? A. Food, Drug, and Cosmetic Act. B. Poison Prevention Packaging Act. C. Controlled Substances Act. D. Durham-Humphrey Amendment. Answer: B. The Poison Prevention Packaging Act requires most medications to be dispensed in child-resistant containers to reduce accidental poisoning. A patient brings a prescription for a medication that requires prior authorization. What should the technician do? A. Call the insurance to override it. B. Tell the patient to pay cash instead. C. Notify the pharmacist and inform the patient of the delay. D. Dispense the medication while authorization is pending. Answer: C. Prior authorization is handled by the prescriber and insurance. The technician should inform the pharmacist and communicate the delay to the patient. Which reference book is best used by pharmacy technicians for checking drug interactions? A. Red Book. B. Orange Book. C. Drug Facts and Comparisons. D. Physician's Desk Reference, PDR. Answer: C. Drug Facts and Comparisons provides comprehensive data including drug interactions, classifications, and dosing guidelines. What is the meaning of the abbreviation SIG on a prescription? A. Sign here. B. Dispense. C. Take as directed. D. Strength of dosage. Answer: C. SIG comes from Latin signa, meaning write on the label or directions to the patient. Which of the following is the correct method for verifying a DEA number for a prescriber? A. Add all digits together. B. Add first, third, fifth digits plus, second, fourth, sixth digits times 2, and verify with the last digit. C. Match first and last letters only. D. Check against the NDC database. Answer: B. A DEA number is verified by a specific formula involving digits and the ninth digit being a checksum. What does the term therapeutic equivalence mean? A. Drugs contain the same inactive ingredients. B. Drugs are chemically unrelated but used for the same condition. C. Drugs have the same clinical effect and safety profile. D. Drugs are from the same manufacturer. Answer: C. Therapeutic equivalence indicates that two drugs provide the same treatment effect and safety when administered as labeled. Which of the following is required on a prescription label? A. Patient's insurance details. B. Physician's medical license number. C. Directions for use. D. Pharmacy technician's name. Answer: C. Directions for use, SIG, patient name, prescriber name, drug name, strength, and pharmacy info are legally required on labels. What is the purpose of the MedWatch program? A. To track insurance reimbursements. B. To report adverse drug reactions and product quality problems. C. To certify pharmacy technicians. D. To monitor drug theft in pharmacies. Answer: B. MedWatch is an FDA program that collects reports of adverse drug events and product problems to improve public safety. Which of the following drugs must be stored in the original container due to sensitivity to moisture? A. Levothyroxine. B. Nitrostat, nitroglycerin. C. Simvastatin. D. Warfarin. Answer: B. Nitroglycerin is moisture sensitive and must be dispensed and stored in its original amber glass container to maintain potency. What does the term DOM mean on a prescription? A. Dispense at will. B. Deliver after waiting. C. Do allow waiting. D. Dispense as written. Answer, D. DA, dispense as written, means the brand name drug must be dispensed exactly as prescribed, not substituted with a generic. Which class of medication is associated with the risk of muscle toxicity and should not be taken with grapefruit juice? A. Antihistamines. B. Statins. C. Beta blockers. D. Diuretics. Answer, B. Statins like simvastatin interact with grapefruit juice, increasing blood levels and risk of muscle damage, rhabdomyolysis. A pharmacy receives a prescription for a drug requiring reconstitution. The label states add 80 milliliters of water to yield 100 milliliters. What is the powder volume? A. 10 milliliters. B. 15 milliliters. C. 20 milliliters. D. 25 milliliters. Answer, C. 100 milliliters final volume, 80 milliliters added water equals 20 milliliters powder volume. What is the maximum amount of pseudoephedrine a customer may legally purchase in one day under federal law? A. 2 grams. B. 3.6 grams. C. 6 grams. D. 9 grams. Answer, B. Under the Combat Methamphetamine Epidemic Act, the daily limit is 3.6 grams of pseudoephedrine. A pharmacy technician is compounding a sterile preparation. What is the appropriate ISO class for the clean air in the direct compounding area? A. ISO Class 1. B. ISO Class 5. C. ISO Class 7. D. ISO Class 9. Answer, B. ISO Class 5 air quality is required in laminar airflow workbenches for sterile product preparation to limit particle contamination. How many 250 mg capsules are needed to fill a prescription for 2 grams of a medication? A. 4. B. 6. C. 8. D. 10. Answer, C. 2,000 milligrams divided by 250 milligrams per capsule equals 8 capsules. A patient is picking up clopidogrel. Which type of warning should the technician be aware of? A. May cause drowsiness. B. Risk of bleeding. C. Avoid salt substitutes. D. May cause constipation. Answer, B. Clopidogrel is an antiplatelet drug, increasing bleeding risk. Patients must be educated accordingly. Which of the following drugs is a proton pump inhibitor, PPI? A. Ranitidine. B. Famotidine. C. Omeprazole. D. Metoclopramide. Answer, C. Omeprazole is a PPI used to reduce stomach acid production, others are H2 antagonists or promotility agents. What is the function of the Orange Book published by the FDA? A. Lists bioequivalent generics. B. Provides drug prices. C. Details adverse event reports. D. Registers controlled substances. Answer, A. The Orange Book lists therapeutically equivalent drugs, brand and generic, based on FDA evaluations. When calculating a child's dose using Clark's rule, what information is required? A. Age in months. B. Weight in pounds. C. Height in inches. D. Body mass index. Answer, B. Clark's rule, weight in lbs/150 times adult dose equals child's dose. Which of the following must be included on a unit dose label? A. Pharmacy logo. B. Refill number. C. Manufacturer, expiration date, and drug name. D. Patient name. Answer, C. Unit dose labels must include drug name, strength, manufacturer, lot number, and expiration date. Which organization is responsible for accrediting pharmacy technician education programs? A. NABP. B. PTCB. C. ASHP. D. DEA. Answer: C. The American Society of Health System Pharmacists, ASHP, accredits pharmacy technician training programs. A technician should avoid which of the following when preparing a chemotherapy for? A. Using sterile gloves. B. Wearing a gown and face shield. C. Preparing it in a biological safety cabinet. D. Handling without double gloving. Answer: D. Chemotherapy compounding requires double gloving and use of PP inside a biological safety cabinet to prevent exposure. What is the main purpose of barcoding in medication dispensing? A. Improve inventory aesthetics. B. Prevent prescription refills. C. Enhance safety and reduce medication errors. D. Block high-cost drug sales. Answer: C. Barcoding systems reduce medication errors by ensuring correct drug and dose are dispensed to the right patient. If a patient takes 1.5 teaspoons of medication 3 times daily, how many ml is that per day? A. 15 milliliters. B. 20 milliliters. C. 22.5 milliliters. D. 30 milliliters. Answer: C. 1.5 teaspoons equals 7.5 milliliters times 3 is equal to 22.5 ml/day. Which of the following medications is considered a LASA, look-alike, sound-alike, drug? A. Amlodipine and albuterol. B. Celexa and Celebrex. C. Metformin and methadone. D. Simvastatin and sitagliptin. Answer: B. Celexa, antidepressant, and Celebrex, NSAID, are commonly confused LASA drugs due to similar names. Which government agency issues NDC numbers? A. DEA. B. FDA. C. CDC. D. CMS. Answer: B. The FDA assigns NDC, National Drug Code, numbers to identify drugs uniquely in the U.S. What is the generic name for Zithromax? A. Azithromycin. B. Erythromycin. C. Clarithromycin. D. Amoxicillin. Answer: A. Zithromax is the brand name for azithromycin, a macrolide antibiotic. Which of the following medications must be stored in the freezer? A. Hepatitis B vaccine. B. Varicella vaccine. C. Influenza vaccine. D. Pneumococcal vaccine. Answer: B. The varicella, chickenpox, vaccine must be stored in a freezer, -15 degrees Celsius or below, to maintain stability. A technician is asked to calculate a dose in ml. The order is for 500 milligrams, and the stock is 250 milligrams per 5 milliliters. How many ml are needed? A. 5 milliliters. B. 10 milliliters. C. 15 milliliters. D. 20 milliliters. Answer: B. 250 milligrams in 5 milliliters. 500 milligrams equals 10 milliliters. Which auxiliary label is most appropriate for doxycycline? A. Take with dairy. B. Protect from light. C. Take with plenty of water and avoid lying down. D. May cause constipation. Answer: C. Doxycycline can cause esophageal irritation. Taking it with water and remaining upright helps prevent it. Which of the following laws requires pharmacists to counsel Medicaid patients on new prescriptions? A. Omnibus Budget Reconciliation Act, OBRA 90. B. HIPAA. C. Food and Drug Act. D. Controlled Substance Act. Answer A. OBRA 90 mandates that pharmacists counsel Medicaid patients, promoting medication safety and adherence.